Are you still finding it difficult on how to write a nursing care plan? Do you still get confused on how to come up with a proper nursing diagnosis? Okay, don't worry, okay? Don't worry. In this episode, we are going to learn about how to use NANDA to write a proper nursing diagnosis. You see, this is a nursing care plan, and you know, sir, the nursing care plan, definitely you are going to write the nursing diagnosis, which you are going to use the patient problem in writing the nursing diagnosis. Okay, I've already shot a video on the nursing care plan. I've taken my time to take you guys through, or take everyone through the front page of the nursing care plan, the middle page, the back end, all the pages on the nursing care plan. You can check it on my YouTube channel, Kelvin TV on YouTube. So in this video here, we are coming to learn on how to use NANDA to write the nursing diagnosis. You see, sir, nursing diagnosis is the patient problem that you are going to change it to the nursing diagnosis. So when we talk of the nursing diagnosis, what is nursing diagnosis? Nursing diagnosis is the clinical judgment about how a patient responds to a health condition. That's what we term as the nursing diagnosis. One format that you need to know, and it's the nursing diagnosis is different from the doctor's diagnosis. So you see, when you take the care plan, we have a place here that we have written the diagnosis. So this place, is what the doctor has diagnosed that particular patient with, or the condition that the doctor has diagnosed the patient with. The problem that most of us we make, and it's because the patient is suffering from maybe pneumonia, we think the nursing diagnosis is maybe the symptoms of pneumonia, and a better patient in the problems, then we use it to write the nursing diagnosis. But no, and this the nursing diagnosis basically is going to you're going to focus on the response from the patient. So you go to the patient when you are using a real patient to write your nursing care planner. That one, you see that you need to go to the patient bedside to talk to the patient. Oh, mommy, the patient and then what is saying, what is going on wrong? Then you'll be having some convo with the patient. So the things that the patient is going to tell you, this and this and this and that, and those are the things that you're going to base on to write the patient complaint, even friendly patient problem. So patient complaints of maybe loss of appetite. So that loss of appetite that a patient is complaining of, that's what you're going to change to a medical term for us to understand. I believe you are getting what I'm trying to say. Okay, let's continue. So at the end of this lecture, you're going to know what nursing diagnosis, how to write the nursing diagnosis, or the format you use in writing the nursing diagnosis. Then we are also going to learn on the PES method. Okay, so when we talk of NANDA, what is NANDA? NANDA stands for the North American Nursing Diagnosis Association. So this association, they provide a standardized list of nursing diagnoses that's being used across the world by nurses. So they know their nursing diagnosis that they provide, that one is the standardized. So they are going to provide a standardized nursing diagnosis. So example, we have acute pain. So we have risk of infection, or risk of infection. And we have activity intolerance. So we have ineffective airway clearance. So all these things now are under the NANDA nursing diagnosis. So in this episode, that's what we are going to do. I know you are getting to understand what I'm trying to say. Okay, so let's continue. So now, when we talk of the PES, the American kind, what is the PES method? So PES, the P stands for problem. So meaning the problem. The E stands for etiology. When we talk of etiology, we are talking about the cause. So you've gone to the patient, you have asked the patient what is worrying her. Maybe the patient complains of chest pain. So the patient has complained of chest pain. That one is the problem. Then, what is causing that chest pain? Causing that chest pain that the patient is feeling. That's what we call the etiology. Then the last one talks about the signs and symptoms. That's what the evidence. So that one is going to let you know chest pain, what is the patient showing, the things that the patient is experiencing, the signs and symptoms on the patient that it shows that truly the patient is what going through that chest pain. That's what we term as the signs and symptoms. So that is what the PES method. So this PES method, that's what we are going to base on to write the nursing care plan or write the nursing diagnosis using NANDA. Okay, so NANDA, when you're using NANDA, it's going to help you to communicate clearly as a nurse. It will help you to communicate clearly so that everybody who is going to pick your nursing care plan will know that you are writing something sensible. So what I say, then it's going to also give you a standardized care. It will help you to give a standardized care, then also help you to plan a proper intervention. That's what the NANDA is going to do for you. So we have step by step. So we are going to take it one after the other. So the step one, identifying the problem. So the first step in writing the nursing diagnosis using NANDA is you need to identify the problem. Identifying the problem. So what is the problem? The problem is what the patient in a culture how you are going to change it. So what is the problem? So maybe patient patient complains of severe pain after surgery. So that is the patient with the problem. So you have just the first step on here, then you need to identify problem. So what you say? So the patient complains of severe pain after surgery. So that one is the problem. What I say? So you need to detect it. So after you have detected it, then you need to change this severe problem in a patient in area. So what I say? Severe pain in a patient in area. So what I say? Into NANDA. So NANDA will say acute pain. Then we are going to understand how we write the nursing diagnosis. So, the first one, as a patient complains of severe pain. So, now you are going to make sure that a severe pain will come as acute pain. So, then what is the cause? So, the next step is identify the cause. The cause of the problem. What is causing that problem? So that will be the reason why we write related to. So in the nursing care plan, you always say you have problem now. Maybe acute pain related to. So what is causing the pain? So we'll be about surgery about. This is how I need to think. We'll be about surgery about complaining of severe pain. What can cause that severe pain on the patient? One, surgery, incision, can cause pain. Such as infections can cause pain. Such as and other complications, even also pain. Such as so the patient has already complained of what? Severe pain. And there was a severe pain in that acute pain. So we are going to look at what is causing the pain. So maybe acute pain related to the surgical incision. Yeah, let's continue. So we've known so what I say, yeah, we said it's pain, I said with pain. Now we said pain and the and only a problem. So what I say, what is causing that pain? So I then I causing that pain, and when I friend what the etiology, the cause. So guys, now we are done with step 2. What we've seen is step 1 is identifying the problem. The step 2 is identifying the cause. What is causing that pain in that patient in our report? I'm very reported to you. And I told say, so we have this idea of pet, you need to think. Because the patient, you say, the patient is complaining of severe pain after a surgical procedure, after surgery. So what I say, and I'm reporting. So say because anyone has undergone surgery, trauma, everything can cause it. Infections can cause it. So inflammation can cause that pain that the person is going through. So anyone that reports we need to think. Then know say what is causing that pain. At the same time, surgical incision, everything across it, that particular pain. So after you've known this one, the step 3 is identifying the evidence. So what is the evidence? What's going to show say the patient is going through that pain now in the outcome. So that one we write to say as evidence by. So we write that one as evidence by. There was a first one problem. The problem here is acute pain. The other patient complaining of severe pain after the surgery. Let us say acute pain. And the next one is identifying the cause. And then just a cause here then. There is acute pain related to such as a surgical incision as evidenced by. As evidenced by. Meaning say what the patient saying. So one, as evidenced by one, redness, everything about patients redness. I know you guys know redness. You can feel some inflammation and as edema because the elbow and other things they show say truly, and the patient is reporting say pain there the elbow. And you know say when the patient is in pain, it can drop the saturation, the oxygen saturation, what will be dropped from the normal to become somehow abnormal. So these things are the things that are showing you say truly, so that the patient is experiencing the pain. As you've already known, we are combining it. You've seen that patients are complaining of severe pain after surgery. So we are turning into a nursing diagnosis using NANDA. So the severe pain will change to acute pain. Acute pain related to meaning said the cause. So related to surgical incision as evidenced by patients verbalizing. Verbalizing that the pain score of 8 out of 10. You know say pain scale let me take you through the pain scale. The reason why I make up the patient verbalizes the pain score 8 out of 10. And he said we have the pain scale. So pain scale they check it for pain. Pain. So we have 1 to 3. So 1 to 3 means the pain here the amount. Then we have 3 to 6, 7, 3 to 6, pain, moderate pain. Then from that place, 7 to 10 going on, and also then severe. That one is severe pain. That's the reason why you come to the patient, I can say the pain, rate here 8 out of 10. Meaning that the patient's pain severe. So that is the nursing diagnosis, and that is how I use NANDA and it's the nursing diagnosis. So your nursing diagnosis answer some questions like 1, what is the patient's problem? What is causing it? There are many causes of problem now. You panic about it. The patient apparently say, loss of appetite. Patients who are losing appetite. What is causing that one? Patient is complaining about shortness of breath. And as a patient they goes, difficulty in breathing. Thought as breathing problem there, then continue in breathing. What is causing it? So then what is backing evidence being and the church said you can truly that's what the patient is experiencing. So that's how we write the nursing diagnosis using NANDA, using the PES form. I know we've learned a lot. So if you have any question, contribution, or you have any suggestion, you can drop it under the comment section. I will be there to answer all your questions. Also appreciate all your contributions. Stick and stay with me, Kelvin, and watch out for another question. I love you.